Give your brains a rest from numbers and settings and everything, and give you some of the rapid fire pearls that actually I picked up. Some of them I picked up at this meeting actually, and a lot of them are from our practice. So this is really about optimizing the patient experience. You know, you can know everything that the best scientists know and the best minds know, but you know, until the patient feels like they had a great experience, it really doesn't much matter. I have no disclosures regarding this talk. So number one is exactly what I said. Patients may not remember what you did, what you said, but they always remember how they felt when they left your office and your visit with you. So you got to make sure you've provided an experience that's a positive one, because you know, great results are not great results. You can do all the things that we just talked about. You can bring them back. You can do other treatments, but making sure that they feel well taken care of is really important. So. That's how they remember you, and then that's what they come back for. It's really the service in addition to the treatments. Number two, highlight your results by taking good before and after pictures. Invariably, especially in treatments that take a few treatments to get the results or have subtle results, patients forget what they looked like. And so we routinely take pictures and show that to them. Even the happy patients, we still show them their before and afters because they're like, wow, you know, that's what I used to look like. And it's true. And you know, there's a lot that goes into good photography. It's not easy to do. I mean, we've been in practice 12 years. It's still a struggle. You know, unless you have, like Dr. Weiss, if you have a professional photographer in the office, it's always a struggle. So, you know, there's some little tips that we do, you know, for consistency. We always we have a photography room, but if you don't, you know, you can try to find a place in the room where the lighting's about the same in each room, and we put a little X on the ground. We have these mirrors in each one of the rooms, and you can order these black matte blinds from 3-Day Blinds, and they come with different color valences, and you can just pull that down in front of the mirror. So if you're doing lasers, you need to cover every mirror or shiny surface in the room anyways. And so this is really nice because you can pull it down. It can do double duty and act as a black background or whatever color you want to use in your patient population. We primarily have lighter skinned patients, so we use a dark background. Rule number three, you know, and this is something that you kind of learn over time, and you know, everybody's got different skills. One of my partners is very aesthetic. I mean, we went through 6 build-outs and moved to a new office about 4 years ago, and I was lucky enough to have my partner with me who was actually very good with aesthetics. I'm good with office flow and efficiency. He's very good with aesthetics, and you know, number one thing he said, he's like, we need less counter space in common areas because it just gets filled with all these stand-up things that all the companies give you and all that, and it looks cluttered. And clutter increases stress, and it makes the office look disheveled and unprofessional. So always be neat and clean. Like I have people that aren't familiar with our office take a walk through and see what doesn't look right and what doesn't look good, and it's surprising what you find. I teach the front desk staff that when you walk in, I want you to look up, down, and all around to see, you know, is there a stain on a tile in the ceiling? And you know, all those little things matter, especially when you're doing aesthetics, because patients look at that and they go like, wow, you know, they didn't take care of that. And it's amazing what people see. It's kind of like a restaurant. You walk in and you see something, you know, you see dust bunnies in the corner in a restaurant, you're kind of like, I don't know if I want to eat there. If you see droppings, it's even worse. So music. So, you know, one of the things we kind of focus on and spend some time on is the music in the office. So we've evolved. We have XM satellite radio in the office. You can get a business version of that, which has a limited number of channels. You know, before you used to be able to play, you know, whatever music and whatnot, but you really shouldn't. You should either have a license for a satellite radio type station. You know, I'm part now of a big organization, so we have our own attorneys in compliance, and so yeah, they either make us use XM satellite, or they said that these are okay, these Sonos systems, because the patient, especially for longer procedures, can just connect their own iPod, listen to their own music, and be very comfortable in the room. Number 5, and I think this is probably one of the most important things, is be accessible to your patients. You know, when you're doing aesthetics, when you're doing bigger surgeries, you know, in my fellowship, you know, the person I trained with, they gave every patient their cell phone number, and I do the same. And it's surprising. It's a safety blanket for most patients, just having it. And a lot of times people have questions or something, and they don't call me, and they come in during their follow-up visit, and I'm like, why didn't you call? And they're like, I didn't want to bother you. So it's surprising, every once in a while you'll get somebody that does call, but it's very infrequent. I think just having that safety blanket is huge. And I put a little logo up here for Google Voice. A lot of practices, if you have different people covering, Google Voice is really nice because you can give them that number and it'll ring to your number, or it'll just go to that number. It'll have a message saying, please leave a message and Dr. So-and-so will call you right back. And what it'll do is it'll actually text you with a transcription of the voicemail they left and get you a notification. And so if you're not good on your feet, this is really great because it gives you a few minutes to think about it before you call them back or look up their chart if you're not good with names. My surgical patients I remember, so I usually just pick up the phone and address it. But if you're not good at that or in the beginning, Google Voice is a great trick. It's free. Get a Google Voice number, and then you're not actually giving out your cell phone number if you want to do it that way. So thank you very much for staying here till the end, and hopefully we'll see you all in San Diego. Thank you.